Alcohol acts as a social crutch, but for some, it goes beyond into addiction. Alcohol can cause serious and worrying social, psychological, and bodily side effects. The NHS estimates that around 9% of UK men and 3% of UK women exhibit such signs of alcohol dependence and suffer the consequences of this. Alcohol dependence, also known as alcoholism, is a serious drinking problem. Those who suffer from alcoholism will find that a major part of their day revolves around its consumption. To feel any physical effect and/or experience withdrawal symptoms when they stop. There are two terms that appear to be used interchangeably: alcohol abuse and alcohol dependence. Those who suffer from alcohol abuse lead largely normal existences, whereas alcohol-dependent will eventually find that their alcoholism takes over. Alcohol abuse commonly leads to a failure to fulfill familial, professional, or social obligations due to drinking, run-ins with the law due to consuming excessive amounts of alcohol and displaying antisocial behavior, encounters with the emergency services as a result of your consumption. Affected by alcohol dependence are likely to give up important activities and ruin relationships and friendships. The simplest ways to identify alcohol dependence in our loved ones are spending each day worrying about where the next drink will come from, planning social, family, or professional events around when they need a drink, feeling a compulsive need to consume alcohol, difficult to stop drinking once started, drinking or feeling the need to have a drink when you wake up in the morning, suffering withdrawal symptoms like nausea, shaking, and sweating. Alcohol dependency is more prevalent amongst those with some form of psychiatric disorder. It can be anxiety, depression, post-traumatic stress disorder, or something else. If any of these scenarios apply to your loved ones, perhaps we can recognize where the root of the problem starts from. Alcoholism does more than just foster antisocial behaviors and lead to breakdowns. There is a long-lasting physical and mental consequences. Some are liver disease, coronary heart disease, high blood pressure, strokes. Physical symptoms by abruptly reducing alcohol consumption are hand tremors, nausea, seizures, only in serious cases, sweating, visual hallucinations. Some psychological side effects are anxiety, depression, irritability, insomnia, restlessness. Symptoms are determined by the severity of alcoholism, but it's impossible to predict how hard or easy it will be. Complete recovery from alcoholism are boosted by the support of a strong network of family members, friends, and by seeking help from professionals. At Serenity Health, Professionals helps you by giving a friendly place and service that makes successful recovery easier. We provide emotional and mental assistance throughout this period and work with you to develop a medication regime. Working together with you, Serenity Health can ensure this by administering a medication known as Librium, chlorodiazepoxide, to treat the symptoms to go much more smoothly. We recommend taking Librium alongside a healthy, balanced diet, which results in boosting of immune system. Serenity Health mainly focus on providing a complete and comprehensive service which not only aids in achieving short-term sobriety, but to give an improved quality of life in the long term. We'll give you plenty of helpful advice on how to avoid falling back into alcohol dependence, such as teach you to look forwards rather than back, to find healthier outlets for your emotions, maintaining long-term sobriety, build a bond with family and friends. At Serenity Health, we make sure you can contact us at any time. We're always here to listen to you and advise you. We provide in-depth treatment plans for alcoholism and are always willing to talk about our services.